Namaste, this is Srinivasa Madanali again. So, welcome back to the discussion on health data. So, we talked about the progress in health space across the globe, including India and our neighborhood. So, now let's look at some of the challenges. So, it's not that everything is rosy, and so we'll look at some of the key challenges. So, again, it's not to go into depth in a lot of areas, but at least to give some directions. So as you can see in this picture, I think many of you can guess it. In the interactive session, I would rather ask the question what these pictures mean. You can see in the left side, you have this. So I think this is many people can recognize this is the COVID-19 virus, and the pandemics like COVID-19 can create a havoc in the world, and it in fact it created havoc for 2 years. It disrupted the life, economy, and everything, and and also killing more than 10 million people across the world. So these kind of pandemics can erupt anytime, anywhere, any point of time. So we have been hearing many pandemics time to time, and they will continue to happen, and we need to be prepared to tackle them. Other one is, so again, you can see here, this is our typical population pyramid. So in about few decades back, we had fewer there were more younger generation working class, age population, and there fewer old age population. So as the time progresses, you can see that, there are fewer working age people, and there are more, more senior people living there. And as the time progresses, with the kind of decreasing fertility rate, and so this will the situation will get worse, where we'll have fewer and fewer working age population, and there will be more and more senior citizens. So what will this imply? So essentially, there will be fewer people to do the work and bring the innovation and pay the taxes. There will be more people will be depending on government, benefits from government, right? So this can create a lot of socio-economic and administrative challenges, and socio-economic challenges because social challenge because who will care for these old age people? When fewer and fewer younger people are there, right? So with fewer younger people, fewer working age population, the economy will also take a toll, and there will be little lesser and lesser tax available for governments. Right? This is the typical scenario for most of the developed countries, and also some of the almost developed countries like China. So their fertility rates have come down significantly. They're far below the replacement rate. So we'll get into this detail a little bit. So this picture represents the climate change, and because of the so there's almost very clear that the human activity has triggered or at least added to the climate change, and this can make the weather the pattern very unpredictable. So more rain, heavy rain, or no rain, severe drought, so and have very high or low temperatures. So those things can happen, and that can create food, our ability to grow food predictably. So that will be a major challenge, and also it can bring floods and droughts everywhere, anywhere and everywhere. Okay, so if you see this demographic disasters happening, essentially there are fewer and there is lower and lower fertility rate in most of the developed countries and so many of the developing countries. But in some areas, like in South Asia, that includes Pakistan, India, Bangladesh, and a lot of African countries, we continue to grow. Sadly, we have very high population density, and we are struggling to feed them, provide basic needs like housing, health, education, infrastructure, etc. We continue to grow, and there are a lot of brain dead economists, and then sociologists, and then even ecologists, the climatologists. They don't want to talk about this disaster that's happening. Okay, so I'll talk about that a little later. But these are some of the challenges, so we're seeing in the health space. So let's look at little more details. As I said, infectious diseases can erupt anytime. H1N1, Zika, Nipah, Mpox, and then there is now the GBS that is that has surfaced in Pune and Maharashtra, and that can spread. Hopefully, we can deal with that and contain it. Okay. So, the COVID-19. So it created global turmoil. Nearly 15 million people died globally, and global economy uh, was crippled for 2 years. And we're still kind of recovering. I mean, mostly we have recovered, but like the last 3 to 4 years of the growth. Global aging population, as I told you, this is an issue in developing countries. Demographic disasters happening in two kinds. One, I said, poorer countries of Africa and South Asia, we are continuing to grow. Whereas richer developed countries, they are facing the demographic, the lower fertility rate and depopulation in many areas. And then the biggest thing is the lifestyle related issues are exploding. These are what they call as non-communicable diseases. Essentially, these are not infectious diseases. They related to lifestyles, with over nutrition, wrong nutrition, sedentary lifestyles, and adulterated food, pollutions, etc. Those are the causes of these things. A lot of cardiovascular diseases, heart diseases, kidney and brain, and etc. Those are all cardiovascular diseases. So those things are exploding, and the cancers are increasing, and the Alzheimer's, Parkinson diseases are also increasing with age. With life expectancy growing. And another major area is the healthcare costs spiraling across the world. The US is spending almost 18 to 20% of GDP for health, and the costs are increasing in almost all countries. Okay? So let's look at these things in a little more details. As I said, the pandemics can create havoc, and just the COVID-19 undone all the progress that was done in last 10 years. So before pandemic, average global life expectancy was 73.1 years. Now, after 2 years, from 2019 to 21, it dropped to 71.4 years. So this is partly because of the excess deaths happened during COVID, 15 million, and also the collateral impact for the other reasons or other areas. So, this kind of COVID-19 kind of situation can come up anytime. So hopefully we'll be able to deal these things better. But we can't simply hope. We have to plan and prepare, prepare for these kind of things. And the population decline in the developing world, as you can see that demographics in China, it's growing in the aging age population. Senior citizen population is significant, and it can the at the bottom of this pyramid you have the lower age population, the younger population, and it will continue to decrease with the lower fertility rate. Whereas this middle age and later age population will continue to grow. This later age population or old age population, it's going to put a lot of pressure on government finances and society. Okay, so if you see this one in 2100, this could look like this is as of now, and this could look like there will be so many people in the top, that is at the higher age brackets. Okay, and there won't be enough people to take care of them. Yes, we can think of the robots and other things, but so somebody has to bear the cost, right? So if there are fewer and fewer younger population and working age population, there will be lesser tax for the government. So that has to be and kind of addressed in one way or the other. So no country has a clear clue on how to handle it, but this is kind of it's impending. So if you see that birth rate in China was almost eight, six, and 7.5 and 8 in mid 1960s, and it has dropped to below 2. Okay, so same in Japan, it's 1.3, and India is 2.03. Okay, so we have dropped from the fertility rate, that is the number of children that a woman would bear in her lifetime, has dropped from 6 to close to 2.2 in India as of 2020, and probably it's a little lower now. So China is 1.16 and Japan is 1.36. So generally, this fertility rate will decrease once the countries become developed. The key thing here is that so in case of China, even before they're fully developed, they're reaching higher income. Their fertility rates have already come down below that of Japan. And if you look at the Japan or the years, 1950, you can see the very small percentage of the population was 65 plus age. Now you can see that significant part of the population is 65 plus age. And the working population, it increased and then it has been decreasing and it will continue to decrease. The key thing is, that the younger population below 24 years, you can see that how it is kind of coming down. Okay, so this will create a lot of socio-economic challenges in those countries. Whereas in case of India, we are continuing to grow, though fertility rate has come down because our base is so high. We are continuing to add so many people to the overall population. The biggest failure in the last 50 years, I would say, our inability to control population. People still don't want to take the population as a serious issue. You can see that in last 25 years, India has added 45 crores, 450 million people in the last 25 years. That is the entire population of USA, Canada, and Australia combined. So who will provide this the housing, and it's just in a matter of 25 years. USA, Canada, and Australia, that the population has increased, reached those levels in the last 200 years, and we have added that population just last 25 years. How can a country can cope up with this kind of a sudden increase in the population? We have to provide housing, food, education, health, healthcare, entertainment, and all the employment and so many things. We simply don't have resources for this kind of population explosion. So the only way we can do this, we can manage the growth, economic growth at per capita, not the total thing. Okay, total GDP will continue to grow with increased population. At some point, even that will stop if you don't handle the population. This is a myth and dumb idea that is circulated by the lot of these brain dead journalists, brain dead economists, and brain dead ecologists who don't want to talk about the population explosion in South Asia and Africa, but they will continue to talk about climate change and the pollution and whatnot. Okay, so it's still an issue, and even if we cut down our population by 50%, you will be still two times the size of USA, and our economy will be still one fourth of USA. So that's we have to remember. We don't need this kind of population to for any kind of economic growth. In fact, the one of the reason China grew very well from 80s, 90s, and 2000 is because they stabilized the population. So let's look at the demographic, the fertility rate across India a little deeper. You can see that most of the southern and western part of the country and some northern part of the country, so the J&K, Ladakh, and Himachal Pradesh, Punjab, etc. So and also in most of the southern states. So the fertility rate is below replacement, which is a good thing. And but the fertility rate is still very high in Bihar, Tripura, Jharkhand, and Uttar Pradesh. So these are significantly populated area. From Delhi to to Dhaka, the population density is more than 1,000 for every single square kilometer. Okay, so that's very high. We really can't ecologically and economically and socially, politically, we cannot sustain this kind of population. So it has to be contained. And there are other challenges. With so much of population, we still have on one side we have unemployment problem, on the other side, the most of the agriculture and the industries are begging for laborers, and there's a total mismatch between the supply and demand of the people, the skilled labor, or the willing labor for agriculture and industries. So let's look at the trend of this fertility rate over a period. So if you see 1963, China's average fertility rate was 7.5, Bangladesh 6.8, and India was 6.0. Okay. So by 1997, you can say that India and Bangladesh, they all reduced the fertility rate by half, and China dropped to 1.5. And this is one of the reasons for China to, one of the reasons, not the reason, one of the reasons, because they don't have to build new schools, new hospitals, new houses, because they can manage the existing one. Rather, they started improving the existing school, existing infrastructure, for improving the quality and the material wealth of the nation and the families. Okay, so that is the society, right? So this population stabilization in 80s and 90s and 2000s in China so was a key factor for the economic miracle. So by 2023, world average fertility rate is still above the replacement, and it's very high compared because we have 8 billion people on the planet. And just to give a little bit of a comparison, so just about 100 years back, it was just for 2 billion. Okay, so now we are about 8 billion. For every one person that was there 100 years ago, now we have about 4 people. So we have to keep remembering that. And the Bangladesh is such a tiny country. They have their, the population density is the highest in the world. And also extremely low-lying area, and they're extremely vulnerable for climate change. With the increase in the sea level, half of the country will be underwater. It's very difficult to kind of sustain this kind of population in Bangladesh. So next is the lifestyle related issues. As I said, the lifestyle and old age related issues, non-communicable diseases. That means they don't spread from person to person, but they happen because of the lifestyle. Whether it's because of the way we live and work and play and eat. These are the things. The obesity is a major issue. Cardiovascular diseases. The heart disease, heart, kidney, and strokes. Those are all cardiovascular diseases. And then the cancers are increasing for various reasons, with the increased age or the life expectancy and the pollutions, and stress levels, such as the cancers are increased. The Alzheimer's and Parkinson's, these are largely related to age-related issues, and other factors are there. But with people living longer and longer, there is a risk of these things are very high. So these are all very expensive to deal with, very hard to deal with for individuals, families, and the governments. As you can see, the kind of causes of the death in the world in 2021, vast majority of the deaths are happening because of the, it's in 2021. In 2021 itself, COVID-19, then about 8 million people died. And in 2022, etc. So more than 15 million people have died in COVID-19. So even above that, you have cardiovascular diseases, 20 million people, 20 million deaths in cancers. And there's so many other chronic respiratory diseases, digestive diseases. These are all largely lifestyle related issues, and they're very hard to deal with. So this is the kind of trend that's happening globally, especially in the developed world. It is non-infectious diseases or non-communicable diseases that are causing the health challenges, and the rest of the world is catching up there. And the healthcare costs, I think maybe I can pause here, because this is going to be a little more uh, involved in terms of the cost, and it's a kind of, a lot of people would be interested to know in details. I'll pause it here. As I said, one is that the infectious diseases, the pandemics can still erupt, and the non-communicable diseases are exploding. These are the major issues. And the next one is the cost. I'll talk about that in the next video. So let me pause it here.